Well, I'm now joined by Inka Weissbecker from the International Medical Corps, and we're going to talk about mental health in a humanitarian crisis. Inka, welcome. Thank you very much for joining us today on Global Health TV.
Yeah, thank you for having me.
Now, how big an issue is mental health in a humanitarian situation?
I mean, most people really don't know that mental health is actually a pretty big problem. From the public health perspective, mental health problems cause more disability than malaria, TB, and HIV/AIDS combined, which is about 12 to 14% of the global burden. Most people don't know that. That number is even higher in humanitarian settings, where mental health problems that have like a baseline of about 10% of common mental disorders double after humanitarian emergencies or crises, and most people are not aware of that. So it's really a big invisible burden.
So what effect would a war have, or a drought, or a big disaster?
Yeah, I mean, there are several different stressors you have to look at. With a disaster or a crisis, it's not an event, it's really a process for people to be displaced, to deal with loss of family members, of relatives, to lose their routines, to lose their livelihoods. Those are big stressors that would affect anybody. So most people experience distress and stress reactions, like they can't sleep, they feel depressed, hopeless, they might have nightmares, children as well. That doesn't mean they're mentally ill at all, but it means that they do need some support. Some people will develop mental health problems such as depression or anxiety, PTSD, and those people as well need access to appropriate services.
As you say, it's a big issue, so why doesn't it make the headlines?
Yeah, I mean, it's a really good question. I mean, one of the things is maybe that it doesn't cause mortality as much as other physical disorders or problems. So you don't have like high mortality, maybe people don't see it as an emergency as much, but it causes a lot of disability, which then causes, people's impairment in daily living. They can't do their job, they can't pursue their livelihoods. It affects the whole family and community, so it's really invisible and also very stigmatized, because mental illness is something a lot of people don't want to think about, don't want to deal with. They think it's maybe related to personal weakness, or people should just get over it, and they don't realize that it's actually a disabling illness that can affect anyone, and especially after crises.
What can be done? What do you do to help?
Yeah, I mean, first of all, it's really important to be aware of international guidelines in mental health and psychosocial support that exists. Interagency guidelines on mental health and psychosocial support in emergency settings from 2007 exist, that were agreed with many UN agencies, international organizations, and that basically spell out everything, how to address mental health and humanitarian crises and emergencies. And not just mental health, but mental health and psychosocial support integrated in all the other sectors: nutrition, water, shelter, protection, information. Mental health and psychosocial support is relevant for all these different sectors. So we have to look at how to integrate mental health, how to promote mental health, and also how to treat and manage people who have mental health problems in humanitarian crises, which includes, for example, integrating mental health into primary health care, which is something that has been pushed by the WHO, integrating mental health and psychosocial support in nutrition programs, providing psychological first aid. Many of these interventions have been done, tested, or recommended, but still there's no rollout or scale up or awareness that those options exist.
Inka, thank you very much indeed for joining us today on Global Health TV. Thank you.